Thank you very much. You do have another bill?
Yes.
AB 1025.
Thank you. Thank you, and thank you, Senators. It's an opportunity to present AB 1025, which in many ways is a complementary bill. AB 1025 would help to provide mental health services to students in our schools. We know that many of our students experience trauma from violence or abuse or the impacts of poverty, or just may need some support around special education, around counseling, or addressing behavioral issues. AB 1025 would help to strengthen partnerships between county behavioral health systems and our school districts to provide these very same services and to utilize resources like Medi-Cal to make sure that our students have the ability to have first-rate counseling, first-rate special education services, and first-rate behavioral services in school. These are proven to help support student achievement and obviously have a tremendous benefit to supporting youth development. I'm honored to have a number of witnesses here today who can speak to this bill and have direct expertise. Some of them include Mr. Rusty Seelix, who's today representing the Steinberg Institute and the California Council of Community Mental Health Agencies. Also, Ms. Camila Barber, who was a witness in the last bill, is also representing Lincoln Child Center, an agency that actually provides mental health services and helped to craft this bill. And there'll be other witnesses who will introduce themselves.
Okay, thank you. In support of the bill, please.
Thank you. Rusty Seelix, California Council of Community Mental Health Agencies, Steinberg Institute for Mental Health, and Mental Health America of California. We wanted this bill to be introduced so that we could take two incredibly successful pilot programs, one in urban Alameda County, one in rural San Bernardino County, that created these multi-tiered systems of support that offer teachers access to mental health professionals at any level of a child's mental health problems. The first level is like positive behavioral intervention supports. The second level is like the early mental health initiative, which was a categorical program eliminated 2 years ago and proved that it paid for itself by keeping those kids out of special education and child welfare. This puts it all together, and both of those programs, those pilots, which were initiated by county mental health funded providers, showed that if the school districts came up with the money to cover the non-Medi-Cal kids, because the county money covered the Medi-Cal kids, it would pay for itself and reduce special education costs. We met with representatives of school and county groups last fall and said, what would it take to get everyone to be doing this, because it pays for itself and it produces great results, keeps kids from failing in school due to unidentified and untreated mental health problems. And they said do a number of pilots so that we can see that this works across the state. That's the purpose of this bill, and we think, like the previous bill, this is something that once initiated will pay for itself, and hopefully this will become a universal practice of all schools.
Thank you very much. Others in support of the bill?
Sure.
No, I'm first. Okay. So I'm in support of AB 1025, and just from my personal experience, I was a clinician providing school-based mental health services.
Just for the record, identify yourself.
Oh, I'm sorry, Camila Barber, Program Manager for Lincoln Child Center. So my personal experience with it is just helping these kids and these families understand what mental health is, and being able to function in the school setting and making them feel like they can be successful, and helping advocate for what services that they need to address the behavioral concerns and really support classroom management. There's just a lot of pieces that our agency, Lincoln Child Center, we've been working in Pittsburgh and Contra Costa County. And we started small. We were in a few schools, and now we're in the whole district. So they've really embraced mental health services in the school setting, and it's made an impact in the community, and a lot of people, and we've seen improvement in attendance, improvement in the classroom, and feeling more connected to their schools, as well as their teachers, and the families really feeling connected to their community.
Thank you very much. Others in support?
Yes, Daniel Savino, Association of Regional Center Agencies. The regional centers coordinate services and supports for over 280,000 Californians with developmental disabilities. Many of them are in the education system, and they do represent a population that the author is very much recognized and included in this mental health issues do occur at a greater frequency for people with developmental disabilities, and a holistic approach to treatment and intervention and addressing the needs of each unique individual is really sometimes the only way to do it effectively. This type of project eminently worthwhile and really does take that big picture approach to look at all of the many and intricate moving parts that go towards optimum student success and wellness. So we very much appreciate the authors' work here and are very strongly in support.
Thank you very much. Others in support of the bill for identification purposes, please?
Rebecca Gonzalez, National Association of Social Workers, California chapter, in support.
Thank you.
Danielle Molay, California Alliance of Child and Family Services, also in support.
Thank you.
Leah Dare, California State PTA, in support.
Thank you.
Anna Hasselblad, Steinberg Institute, proud co-sponsor, in support. Thanks.
Thanks.
Anna Namack with the Association of California School Administrators, also in support.
Okay.
Brad Strong, Children Now, in support.
Thanks.
Trudy Schaefer, the League of Women Voters of California, in support.
Thanks.
Nick Romley on behalf of the Sacramento County Office of Education, in support.
Thanks. Okay, any others in support? Is there any opposition to the bill?
Yes, good morning. My name is Sam Neustadt. I'm the Assistant Superintendent for the Solano Special Education Local Plan Area, co-chair of the State SELPA Association Legislation Committee, and I'm also I was an appointed member to the State Special Education Reform Task Force, in which I served a leadership role as the subcommittee chair for early intervention, early learning. Unfortunately, we're here today to express our opposition to this bill. We've been in constant conversation with the author's office and the sponsors of the bill, and we appreciate that conversation, look forward to continuing it. But at this point, we have concerns about the bill because, not because of the program itself. As Rusty pointed out earlier, it's already been tried, it works, but because it targets $10 million that was set aside in the budget for the implementation of MTS, multi-tiered systems of support, positive behavior intervention, and universal design for learning as part of the package to fund the recommendations from the state task force report. One other thing I'd say about that is that money was intended for a statewide implementation. Right now, this would benefit 2 school districts, 5 schools at a cost of $6.4 million. There are 10,366 schools in the state of California, so we're very concerned about the scalability of this model if it were successful. And in fact, if a school district wanted to do this now, especially a school district that is impacted with poverty and EPSDT eligible students, they could do so under the local control funding formula as part of their local control accountability plan. So we're not even sure what the need for the bill is with respect to the authority under the law to do this if a district so chose. For those reasons that we oppose.
Thank you very much. Okay, any others in opposition to the bill? All right, are there any questions from members? Senator Runner? Senator Hancock?
Sorry, but I have to be consistent here. I agree with the opposition. We talked about San Bernardino County already has a program that's successful, so why would we need a pilot program and another part of that $10 million for mental health to go to a pilot program, again, that only helps certain school districts? So if San Bernardino is doing it well, can't we duplicate in other places?
Thank you for the question, Senator. Sadly, there just are many school districts and counties that do not have a successful partnership. And we're using this as an opportunity to lift up the handful of districts that are doing this well to say that this can work. The way this works the best is when the school district and the county's behavioral health agency work really well together to leverage existing dollars around mental health. For whatever reason, as we all know, our agencies don't always talk, don't always walk together, don't always work well together, but we have examples in many counties of where it's working, and that's what this is doing. There's no duplication here. The need for this bill is actually great. It's open to any school district that wants to apply and participate. The need is great. We have heard resoundingly from our school districts they do not have resources to serve children who have high needs. And what we know is that when kids are hurting in any way, they can't learn. Our chair has been a champion on community schools to make sure that there are resources like mental health. But often we just don't have enough resources to go around to make sure that our youngest students have their mental health needs addressed. As a matter of fact, I chaired a hearing this year where we had representatives from a local school district come to us and say, the school district would like to work this by ourselves because we don't have any support from our county. So I lift that up to say that the need continues to be great for partnership, and that's why the need for this bill.
Okay, Senator Hancock?
Yeah, thank you very much, Madam Chair. I was going to say to Sharon Runner, Sharon, don't worry about consistency. But the reason is I was in favor of the last bill, and I've got problems with this bill, and they're exactly the problems raised by the opposition from SELPA. I am concerned about confusion in the budget and in implementation between a pilot project that mirrors in many ways language that was written into the state budget with the support of many of the groups that testified on this bill, and that's part of the scattershot way we do business. We can have several bills varying only in tiny detail that come on any particular topic in any session. But I have carried a bill, it's over in the Assembly right now, it's SB 463, that sets up a statewide program on multi-tiered behavioral interventions, whole school climate, and addresses almost all the issues in this pilot program. We actually have, thanks to Senator Block and others, $10 million appropriated in a bill signed by the governor and passed by this legislature to do that. And as was pointed out, to take $6 million of the $10 million and use it for a pilot program in a couple of counties or a couple of districts is not what the intent of the legislature was. And I just don't want people to be confused about that. The intention really is to have an ongoing statewide program. And so I've been trying to figure out what to do to be a good colleague. We're in favor of the topic, but there are issues of allocation of funds and implementation. So I would really, I mean, to the extent that this bill focuses on medical interventions, which the author mentioned, or specific mental health interventions, which would probably be in the third tier when you're dealing with the students that you don't reach in whole school programs, it could move forward. But I would want language taken in the Health Committee that makes clear this is not coming out of the money that was allocated in the budget for the school-wide programs.
Assemblymember Thurman.
Thank you for the question. And let me clarify, this bill was not written to target the $10 million or any specific pot of money. As a matter of fact, this bill was written before there was any knowledge about that particular pot of money. And I would ask that this committee continue your vigorous discussion and debate. We're open to your suggestions. We're open to working on what pot of money this service would get paid for, but to consider the merits of the bill, and that even with $10 million, $10 million is not enough to address all of the mental health needs that exist for kids, and to consider that all of these efforts are a start in the right direction, but we need to go further. And we're completely open to working with all of the mental health coalition advocates on identifying what pots of money pay for what services. We've also been advised that there may be resources through the Mental Health Services Act and other provisions. And I would only clarify that this bill only focuses on mental health, and I had mentioned Medi-Cal, but interventions. But we're prepared to work with all sources, and we think that we'd ask you to address the policy merits and that we work together to address the financing merits of all of the bills and all of the needs going forward, and we're happy to do that. I'd like to ask Mr. Seelix, who's also been working with many of the mental health advocates on the funding question, to also add some context here.
Right. So I think Mr. Thurman basically answered it. To the extent that we're relying on that $10 million to fund 6 more of these projects, that's not our intent. And if that's what the bill appears to say, we can certainly take amendments to clarify that.
It takes language right out of the budget bill that we passed, which makes it seem as though perhaps it's aimed at that money.
What we want is that this program and these pilots are part of the training and coordinated as part of that, and that this model is considered as part of that, and we can work on language to clarify that, and that other funding will have to be provided for the pilots.
Fine. If it's other funding, that would be fine. It'd be great to have some pilot projects after we get the statewide program going. But because of the similarity in the language,
right.
It did seem as though it might create confusion on the part of implementers or how money would be allocated.
Let's just hold that idea there. Senator Block, the budget person.
Yeah, thank you, Madam Chair. As far as confusion goes, there's often a blurry line between a policy committee and a fiscal committee. In this case, it's not so blurry. These are fiscal issues. I think it's good policy. As Senator Hancock knows, there was good policy she proposed this year on after-school programs, wraparound programs that didn't get funded. And that's an issue for the budget committee, and that's an issue for the appropriations chairs of the different houses. And I'll vote for this as good policy, but that's not saying, because I think this is good policy, is not saying that I think of all the various needs, including after-school programs, that this is the need that deserves $10 million. That's something we'll decide in Budget Committee next year, and the Appropriations Committee will talk about this year.
Oh, Senator Hancock?
Thank you. Through the chair, yeah, I was very disappointed that we didn't get the funding that we need for the after-school and summer programs, because I do think it's a very important part of both education and public safety as well. But the particular language in this bill mirrors, Senator Block, the language that you did report out of the education
subcommittee,
budget subcommittee, and I think it's very good language, and it was very, very broadly supported. So I just want to make sure that that program is not going to be the pot of money to which you are looking for the pilot program, and would be happy to move the bill to the Health Committee as long as it's understood there will be language taken there that makes clear it's not coming out of this pot of money.
Either there or appropriations. I think that's up for those committees to decide.
Well, I mean, okay, but no, but the author has suggested he was also willing to suggest some amendments that were going to be taken over in health, correct? And are you still intent to do that? Because you're going to reduce the number of pilot programs, et cetera.
I'd like to speak to it. And I think that the fundamental premise I'd like to get across is that none of these programs are in competition. We're not saying that one, I know that there's been stated that there's confusion. From my standpoint,
there might be.
From what I'd like to articulate on the record, and if we can do so in the language going forward, is to say that we think that there are many projects that are worthy of being supported and funded to meet the need of a great number of youth, and that we continue the work that we've begun with the mental health advocates to identify how that works. And that if we move with that in mind, that $10 million is not enough, and that these pilots aren't just conversations, they're actually saying we're going to actualize the real delivery of services in places that need it. And they're all complementary efforts, and we're committed to working with the authors of 463, and any other legislation to identify how all of these efforts are funded.
I think Senator, I won't speak for you, but I think we'd all feel a little more comfortable if we got more clarifying language about the $10 million, and that was appropriated in AB 104. So, you know, is that part of the concern of the SELPA?
that would, in large measure, address our concern.
Okay, so if you're willing to work with us in terms of clarifying, because you were not going to take your amendments here in this committee, you have several amendments you were going to take, and we were suggesting you take them in health.
Yes. I'm happy to clarify the concerns about the funding, the $10 million, as you just asked.
Okay, Senator Hancock?
Okay, so we basically agree we're going to put in clarifying language that we're looking for an appropriation for pilot programs, but not out of the $10 million that has been allocated for the program of tiered, multifaceted, school-wide supports that go all the way from restorative justice within schools to individual mental health counseling for kids that really need it.
If I could, I'd like to just ask a question from you, Madam Chair.
Yes.
You asked me if I was prepared to work with this committee and future committees on clarification about the role of the $10 million. I am happy to do that. We've never targeted the $10 million.
Okay.
And so I'm happy to move forward with the question that you've asked.
Okay.
That, yes, I'm happy to state.
All right, thank you. With that, is there a motion on the bill? The bill has been moved. Would you like to close?
Thank you for this robust discussion and for your commitment to our young people. Again, we look forward to working to support as many efforts as we can to help our young people get great mental health services. And thank you, and I urge your aye vote.
Thank you very much. Please call the roll.
Do pass to health. Blue?
Aye.
Blue, aye. Runner?
No.
Runner, no. Block? Block, aye. Hancock?
Aye.
Hancock, aye. Leyva?
Aye.
Leyva, aye. Mendoza? Aye. Mendoza, aye. Monning? Monning, aye. Pan? Vidak?
Aye.
Vidak, aye.
7 votes, sufficient for passage. We'll keep the roll open for our absent members. Thank you very much.
Thank you, Madam Chair and members.
Okay, Assemblymember O'Donnell, you have one item, item 13, AB 827. Is that correct? I'm going to need it in about 15 minutes. Welcome.
Thank you, Madam Chair and members of the committee. AB 827 requires that schools provide their staff with information on support resources for LGBTQ students as part of an existing requirement to publicize anti-discrimination policies. These resources might include anti-bullying policies, gay-straight alliance clubs, or school staff with special training on the support of LGBTQ students, among other resources for student assistance. Research has shown that these resources not only improve student safety, they have a significant impact on student learning. As a teacher, I've seen many LGBTQ students struggle, and I've seen teachers, though concerned and motivated to help, unaware of resources available to help those students. AB 827 will ensure that this vital information is provided to school staff so that they may better support their students. And I have 2 witnesses with me today. Madam Chair, Joe Michael, Legislative Manager for Equality California, and Ronnie Swinburne, a high school student from South Sacramento.
Thank you. Welcome. In support of the bill, please.
My name is Ronnie Swinburne, and I just graduated from an independent study program in Elk Grove. I feel that AB 827 is very significant because it proves American society is potentially reaching a new equilibrium. With my encounters of harassment, injustice, and dogmatic judgment from peers, school staff associates, and even occasionally my own family members, I must say this policy profoundly benefits me. A few differences I've simultaneously recognized in the primary school I went to and my last previous school is that I was extremely hesitant and ashamed to be openly authentic to being myself. Whereas at the last school I attended, it felt comforting being prideful of my gender expression and identity since there was a legitimate support system for specifically LGBTQ youth on campus at all times. Throughout these experiences, I have also perceived this conception that my primary school's faculty were not as willing to be optimistic towards LGBTQ youth compared to the faculty in alliance with my last school I attended due to the lack of enlightenment on LGBTQ civil rights and terminology. Predominantly, the legal enhancement of how necessary it is that the general issue of inequality be resolved by proper communication and unconditional support is an assistance to attaining unity for all. Thank you for allowing me to speak on behalf of this.
Thank you very much. Others in support?
Good morning, Madam Chair and members. Joe Michael for Equality California. Ronnie was kind enough to share his personal story with us, and I'll just make a few general comments about how we view this bill as the sponsor. Despite significant progress in non-discrimination law, lesbian, gay, bisexual, and transgender students in California still often face verbal, physical, and online harassment. In 2013, 91% of California LGBT students reported hearing anti-LGBT remarks. 7 in 10 reported being called names or threatened based on their sexual orientation, and nearly 1/3 reported physical harassment or assault. These problems have a direct effect on student performance. LGBT students who have experienced harassment have significantly lower GPAs, and when students feel unsafe, they miss out on class time. Teachers and school staff clearly play a pivotal role here. Research shows that LGBT students who are harassed or assaulted in school often do not report incidents to school staff, primarily because they believe that school staff will not address their reports. Research also shows, however, that LGBT students with supportive educators, like Ronnie was lucky enough to have, at least at the second school that he went to, skip fewer classes, feel safer at school, and can earn higher grades compared to students who do not have those supportive educators. AB 827 will provide teachers with crucial information to support LGBTQ students and will make California schools safer and more supportive places where all students can learn. We have heard from teachers that they are looking for this information to support LGBT youth, and that's indicated by the educator support for this bill. All students deserve and need safe school environments, and for that reason, we thank the author for bringing this measure forward and respectfully urge your vote. Thank you.
Thank you very much. Others in support of the bill?
Rebecca Gonzalez, National Association of Social Workers, California chapter, in support.
Thank you.
Catherine Williams with the ACLU of California in support.
Thank you.
Dennis Garcia on behalf of the California Latinas for Reproductive Justice in support.
Thank you. Any others in support? Is there any opposition to the bill? The committee did not receive anything in writing. Are there any comments from members? Senator Leyva.
Thank you, Madam Chair. Good morning. I would just like to thank the author very much for bringing this bill forward. I think the sooner that we can teach acceptance and that we can teach tolerance is so important to not just learning and the individual, but to society as a whole. I remember when my children were little and, you know, our golden rule was treat people the way they treat you. And no one should be treated differently. So I appreciate you bringing this forward, and I hope it puts us in the right direction.
Thank you, Senator.
Thank you. Any other comments or questions? Senator, the bill has been moved. Would you like to close, sir?
Respectfully ask for an aye vote.
That's easy. All right.
Do pass to appropriations. Liu?
Aye.
Liu, aye. Runner?
No.
Runner, no. Block? Block, aye. Hancock? Aye. Hancock, aye. Leyva? Aye. Leyva, aye. Mendoza? Aye. Mendoza, aye. Monning? Aye. Monning, aye. Pan? Vidak? No. Vidak, no.
Okay. 6-2, sufficient for passage. We'll keep the roll open for our absent members. Thank you very much.
Thank you.